Welcome, Houston, to Chai Time. It is Monday morning here on Chai Time, and where is the sunshine?
Like, somewhere behind the clouds.
Every time I'm on the show, there's no sunshine. I think that's a sign.
You are the sunshine.
Thank you. That's what I was going to say. I vote for myself. But thank
See?
you.
All the love.
I know. How was your weekend?
Weekend was good. Had a lot of fun.
Yeah.
Went to the Cry Gala, so it was nice.
Yeah.
Great turnout. Got to meet Bollywood star Neelam.
Oh, wow.
She's so gorgeous. She's beautiful.
I know, she looks good on like television, so I can't even.
Yeah, that show, right? Bollywood
Yes.
Wives. Yeah. And they raised a lot of money, so kudos to the entire Cry team. Yes.
Amazing.
Always fun to dress up into the Indian outfit
Yes, exactly. It's
and
like
Bollywood style.
Exactly. It's like a Halloween on steroids, though. Because everyone's dead. And joining us today is Dr. Jessica Rohr. She's a board-certified clinical psychologist with an additional certification in perinatal mental health. Welcome.
Thank you
to the
so
show.
much. I'm happy to be here.
Yes.
I'm excited.
You are so beautiful, by the way.
Oh, thanks.
Yes. Those who are watching us on Facebook, look at her. She is beauty.
Thank you. I have a good dermatologist. It helps.
Welcome on the show. Tell us about your weekend. How was it?
Oh man, what did I do this weekend? It's Monday, so the weekend is gone. It was great. It was my baby was sick. She was a little sick, so we took advantage and just snuggled and watched movies all weekend.
Love that.
And we live out in Sugar Land, and a friend of ours is starting a new biking group for kids called Gnar, Gnar.
Okay.
And so that's a blast. And she's,
Yeah.
my old, I have a 2-year-old and a 5-year-old, and so the oldest is really getting into it. And so we had a lot of fun. It's I think for a different team sport as opposed to soccer or something like that. Learning how to bike.
That's
So,
different.
Yeah.
I've never heard of that, but that's
I think
pretty
it's going to
cool.
be cool. Yeah.
Yeah. Wow. Well, it is May, and it is still Mental Awareness Month. So today we will be talking about maternal mental illness. So what is maternal mental illness?
So we talk about maternal mental health. It used to be primarily postpartum depression that people thought
Yes.
of when they thought of maternal mental health. And as time has gone on and we've learned more and people are more willing to talk about their experiences and not so scared of what might happen if they do, we've learned that postpartum depression is kind of the tip of the iceberg. So we know that mental health concerns do not just start postpartum. In fact, I think it's 30 to 50% of any of the mental health issues that arise postpartum actually started while mom was pregnant. And so
Wow.
when I say perinatal mental health, that means the time before the baby is born and up to a year after baby is born. So now we're kind of expanding and understanding that perinatal mental health is important. And then on top of that, there is this sense that postpartum is about a year after you have the baby, and once that comes, you should have it all figured out, and it should be easy now.
Yeah.
And as we know, as you and I both know,
It's not.
that's not how that
Nope.
works. And so kind of understanding that maternal mental health is a reflection of how difficult it is to be a mom with what we have in today's world, with the resources that we have available to us, with the way that being a mother, the way that women often have to be a mother on top of doing everything else. Yes. It's just an understanding that some of the normative issues, and when I say normative, I mean the things that pretty much everybody deals with as a mom, and then also some of the more, our language is pathological, but things that mean something deeper is going on. The difference between being sad and being depressed.
Yeah.
So maternal mental health is sort of all of that.
Yeah.
The process of being a mom and how tough that is, and how there hasn't been a lot of attention paid to that.
Yeah.
That all kind of falls under the maternal mental health umbrella.
I always say I wish there was like a little pamphlet that was given to you when your kid is born. Like, hey, here you go. Here's what you need to start doing, and as far as taking care of yourself and also taking care of your baby. And obviously, that does not exist. You have doctors around, you have help around, but still, what you're going through in the inside, no one can really ever know.
Absolutely, and it's really hard to even help people understand that ahead of time.
Yeah.
Because as you know, becoming a mom, I've tried to describe what it feels like to become a mom, and waking up and realizing there's a part of your brain that just doesn't turn off anymore. And
So true.
it's a very strange experience. And some people, I had postpartum depression with my first, and so I don't know if I was more attuned to it or if that was a sharper difference for me or a more painful difference. But I've spoken to enough folks. In my job, I'm 50% research and 50% clinical. And what that means is half the time I'm doing research, we're coming up with research ideas, seeing participants, producing, publishing on maternal mental health. But half the time I'm working with moms and talking to them about what they're going through. And all of them have this kind of shared experience. You know, there was this really interesting article that came out in 2017, Hoaxema et al., looking at MRI, so kind of a brain scan of moms pre and post pregnancy. And what they found is that our gray matter actually decreases in our brain. We have less brain gray matter after pregnancy. Our brain actually shrinks with pregnancy. Really? So pregnancy brain is real.
Wow.
But what they found, what that means is, it of course it's very scary. It's like, well, that's where my brains went. But it's what it means.
Explains a lot.
It explains, that's what I said when I read it. But what their theory is, the area where the brain, where the gray matter is reduced, is the same as what they call theory of mind. And so that's my ability to look at you and think, she looks relaxed, she looks interested, I can continue talking with her because this is a nice conversation. And that skill is really important with a baby who doesn't know how to talk. So basically our brain is getting more efficient at quickly looking at our baby and recognizing what they need. So there is an actual, that feeling I had of something's just different in there was actually true.
That's
it is
crazy.
Something is different when you gestate a baby, bring a baby to term and have the baby. So the idea of being able to prepare women for that change has historically been tough, because it's hard to explain something when you really won't know what it's like until it happens. So it's less about this is what this is going to feel like, and more about let's create the village that's not so easy to access anymore. Because
so mine was an opposite kind of thing. So I had a hard time conceiving. And when I did conceive, I didn't want anyone touching my baby. I wanted to do everything from feeding to changing diapers to like name it all. And I had a village. I had so much help. My mom, my mother-in-law, my sister was here, but I didn't want anyone to help me. So I don't know if how that was even a thing, but
that sounds like totally could be wrong, but a little bit of anxiety in the postpartum period. But a lot of when we talk about having a village, so many people nowadays, and of course, I want to say, of course, this varies person to person, but so many people nowadays, they want to come over and see the baby. They want to hold the baby. They want to coo with the baby. They want to hug the baby. What mom wants is for you to come over and wash the dishes and wash the laundry that's been sitting there and sweep and take the dog for a walk. So mom can sit there and do the baby stuff. And so even being able to communicate that when you're exhausted and you're not used to setting boundaries. A lot of moms aren't used to setting boundaries. In fact, a lot of moms, and women in particular, are socialized to not have boundaries, to do everything for everybody else. And so all of a sudden needing to advocate for yourself in that way is really hard.
Yeah, that is so true.
Yeah.
Oh, wow. Okay, so why is maternal mental health an important topic? Why do you think it's an important topic?
So my first answer to that is always because it is. It's women, it's moms. Everybody either has a mom or knows a mom or is a mom. 80% of women throughout the course of their life will be a mom. So to me, maternal mental health is people mental health. But more than that, and for people who sometimes need convincing, there are considerable relationships between a woman's mental health and every part of the pregnancy process, childbirth process, and how their children develop. So people who have any kind of perinatal mental health issues during pregnancy are more likely to have emergency C-sections, more likely to give birth early, more likely to have small for gestational age babies, more likely to have hemorrhage at childbirth. Then they're more likely after childbirth to have postpartum mental health issues. If you have them prenatally and they aren't treated, then they're likely to continue in the wake of
Yeah.
sleep deprivation and all of that. And then that can impact your ability to bond with your baby. And then we can even see 5, 10, 15 years later in the baby changes in their behavior, their mental health, their academic achievement, different things like that. So from that point of view, just its impact on mom, baby, if mom is depressed, male partners, dads, are more likely to be depressed. It's a very consistent finding that we see.
Wow.
And economically, it's a staggering cost. The impact on the health system, the impact on work, mom's ability to go back to work and feel, some people have to go back to work, some people want to go back to work, but either way, it's impacted by how you feel. So the cost is really significant at a kind of a societal level, at a community level, in your family. It takes a toll. And there's a lot of discussion right now, at least in the research community, how do we start to change these cycles, these kind of intergenerational cycles of these disparities in people's ability to thrive and be healthy and be successful. And I really believe that our failure to fully address maternal mental health is one of the reasons we haven't been able to interrupt those cycles, because that's where it starts. Wow. That's what I think.
If my brain could talk. Actually could, I am.
You're doing it.
Okay, so if not true, what are some statistics you can share with us to highlight this issue?
So in general, the stat that people go to for postpartum depression is 1 in 5. So 1 in 5 women will meet criteria for postpartum depression.
Wow.
So that's sizable.
Yes.
And that is almost certainly an underestimate, because there's so many reasons why people are unwilling to admit when they have issues. I lied happily, fluidly on my screening measures when I went to the pediatrician. I was like, nope, I'm great.
good.
I'm doing really good. I don't want to talk about it.
Yeah.
And that is as someone who has never been impacted by institutional racism. I'm a white woman. That's not something that I had to worry about. And so didn't worry that they would take my child, didn't worry that they would look down on me, that they would assume that there was something wrong with me. Yeah. I just knew as a psychologist, they would encourage me to go to therapy, and there wasn't a chance I was going to go to therapy. Because that's just not what I was going to do. Leave my baby it was a non-starter. So almost certainly that 1 in 5 stat is an underestimate, especially because now we recognize it's not just depression. There's postpartum anxiety, which may even be more common. I've seen 1 in 4, 1 in 3. Postpartum PTSD, postpartum OCD. These are all issues that come up during the perinatal period and are likely impacted both by mom's kind of predisposing factors and her individual reaction to that flood of hormones when the hormones just whoosh out of you after childbirth. Yeah. We all react differently to that.
How long does it take for you to
whoosh out the hormones?
Yes.
So the whooshing is it's instantaneous. Your body once it's no longer needing the hormones to sustain and grow the life inside you, they leave. So within about a day, you'll start to notice baby blues, weepiness, kind of the normal reactions to that hormone change. And then a little bit later is when you'll start seeing more of that kind of identifiable mental health concerns, depression, anxiety, things
and
like
how long can that stay?
If untreated,
yeah.
I mean, I have someone that I'm working with now who thinks hers never went away. Her kids are 9 and 10. So if it's untreated, I mean, it doesn't get easier once you have the kids. And so if it's untreated, it can definitely sit there. Again, like I said before, women are often socialized to keep the peace, make everybody else happy, not set boundaries. And so they'll kind of suffer in silence and just think, I'll just pour myself into my kids, and hopefully that'll be enough.
Okay, if time, what issues can arise? Obviously, we just discussed that. But what are some of the most common conditions or diagnoses do you see?
I see a lot of postpartum anxiety, and that's what made me really interested in kind of the literature on that, because I see it a lot more than I see depression. Mm-hmm. And so the difference between the two, postpartum depression tends to be, well, let me kind of lay out some different things. So baby blues, right when the baby's born, lasts 3 to 5 days and is a lot of weepiness, a lot of really kind of bodily feelings. You just feel really down, you feel really fatigued, you feel tired. It's just that flood of hormones leaving you just makes you feel kind of off, not yourself. Depression usually is associated with a lot more cognitive symptoms. And so cognitive is like your thoughts. And so it's a lot of thoughts like, this baby would be better with a different mom. I'm not the right person for this baby. I'm never going to be able to do this. Maybe this was a mistake. A lot of these kind of deep thoughts about the mom's fitness for being with the baby. We can see suicidality. We can see, again, like crying, just like a profound, we call it dysphoria. That's just like a profound like body sadness. Issues sleeping, even if baby's asleep. So even if baby's asleep or safe, issues sleeping because mind won't turn off, just kind of circling about how horrible this is. And so there's a difference between, man, this is really hard, and this is so bad I can't see a way out of this. Anxiety tends to be a lot of anxiety about baby's health. So it's a lot of checking and a lot of not letting other people help, and a lot of needing to do everything yourself. And that's what I see a lot of. And honestly, what I'll see a lot of times is people not realizing that it doesn't necessarily need to be that way. They may be coming in like, I just feel kind of overwhelmed. I feel like I'm not getting enough sleep. I need some help with, and I'll talk to them and realize they're not letting anybody help. And the reasons why are not like because my husband is a dropper and will drop that. It's not like reasons that are legitimate that you probably wouldn't want them to do things. A lot of waking up to check on baby while they're sleeping and when mom should be sleeping. And so their sleep is interrupted. And then when sleeplessness is a torture device. It is absolutely worsens everything. And issues with sleep will start in the prenatal period. And often will not be addressed because mom will bring it up to doc, and the doctor will say, being pregnant's hard, and not realize this is not just like normal, my belly's big, I'm having trouble finding a position, but it's like I'm waking up at 2 and not able to go back to sleep for the rest of the night. So we do see a lot of, and I know I'm kind of going off the rails here, but we do see a lot of over-normalization of issues that probably should be attended to a little more. By doctors kind of saying, it's, welcome to being a mom, these kind of things like that. And mom goes, oh, okay, I guess this is what normal. This is normal. And they just kind of suffer through it because they're like, for some reason, normal is a lot harder to me than it seems to be for those people. But I guess that's because I'm the problem. And then they don't bring it up again. And then, like I said, what's the word I'm looking for? Not under identification of things that should be identified as issues. So like the checking, things like that.
I wonder if they have, like, I know when I take my kids for their physicals yearly, they have us fill out this form, with their behavior and what they're feeling and all that, right? I wonder if they have that for moms. They should have something like that when they go, like, especially the first few maybe years of the moms, like when they go for their OB appointment, they can like have a list of questions that they ask, like how you're feeling, and then maybe address it at that time if they feel like, okay, wait, these questions don't like sound right. Maybe there's something wrong. Maybe we need to address it. Because like you said, a lot of parents don't speak about it. A lot of moms don't speak about it. And maybe this would be a way to like just kind of write it down on paper when they're going for their yearly checkup. And
absolutely. You've opened a can of worms, my friend. I know. Let me talk to you about screening. Let me just talk to you. So screening is an incredible idea. It definitely is. It is the recommendation of the the American College of Obstetrics and Gynecology that women are screened at least once during their prenatal period. And usually at childbirth and usually once postpartum. A reproductive psychiatrist who worked here in Houston for a while, Dr. Lucy Purrier, made some huge strides in screening at the pediatrician's office. So if any woman ever goes to a TCH with their newborn, they will get, it's called the EPDS, the Edinburgh Postpartum Depression Screening or Scale. So screening is kind of, I mean, that's sort of the way we do things. That's the medical model. You present mom with a list of questions, and she has to self-report issues on there without knowing where it's going to go, and without knowing if there's resources for if she is struggling. So that's what we hear a lot from providers is, I don't want to screen because if she tells me she's depressed, I don't have anywhere to send her, because that at the most basic level, we don't have a ton of resources for moms. It's just, again, when I talked about our failure to address maternal mental health, the investment in people to help address it is not where it needs to be. So a lot of doctors will not screen because
they don't know.
If they get told there's a problem and don't know how to deal with it, that's a liability. So screening is kind of, it's not as universally implemented as the recommendations say it should be. I recently did put out a review article on universal screening and kind of talking about some of the downfalls of it, because I tend to think that without an infrastructure in which screening leads to actual care and addresses all of the barriers to care that are there for, like I said, I'm a privileged white woman who lied on it because I knew that there wasn't a chance I was going to commit to 12 weeks of therapy, 1 hour a week, have my baby stay somewhere, come in, talk about my, there wasn't a chance. And I had the resources to do that. I was on maternity. I had paid maternity leave. That's a very rare thing. So if I couldn't do that, there's not a chance that most people could do that. And so to me, the idea of screening without first addressing that problem it feels like a Band-Aid. It feels like see, we did it. So and again, I've talked about being white, but for women of color especially, at every step of the screening process, we would lose them to follow up. So women of color are less likely to even be screened. They're less likely to be believed on screening. They're less likely to be, and then less likely to be honest on screening because of concerns of what might happen. Less likely to get appropriate follow-up, less likely to follow up, less likely to fill medication, right? Every step of the process. And so what I have been thinking about and what our team has been thinking about is screw the screening. Oh, sorry.
That's okay.
We didn't bleep you.
You can bleep me. Is get rid of the screening and just assume becoming a mom is hard. It is not an easy thing that you just 9 months, pop it out, go, you know what you're doing. In general, it is more likely to be difficult. And so instead of screening and having people have to self-identify as having a difficult time, and then again, oh, she's the weird one who can't. Every mom gets kind of basic education and information, like the pamphlet you were talking about. Basic information and education about this is some stuff that's going to be tough along the way. These are some things that would come up. Here's how to go ahead right now and identify trustworthy people who you don't mind, saying something to you, like, I think something's going on, I think you need to follow up, or you don't mind calling your doctor for you and get that on there. Here's what depression looks like. Here's what baby blues looks like. Here's what DMER looks like. This is something I didn't even learn about until I got to a highly specialized training, which is nuts. It's dysphoric milk ejection reflex. And so some moms, we don't know how many because it's not well studied and not well identified, when their milk lets down, when they're breastfeeding, they have a few minutes of just a profound sadness. They just feel really sad. And so the theory is that you have a dopamine decrease in order to allow the milk to flow. And so you're just naturally, and dopamine's a happy neurotransmitter. But people never talk about this. And so I felt so kind of honored and lucky. I have a patient right now who's postpartum, and she's like, I have been having the weirdest time. I've never had it with any of my babies. It's her 4th baby. But every time he latches and my milk lets down, I just feel like I'm falling apart and I'm going to cry. And I was like, it's DMER! That's what it is. It's okay. I know what it is. And she's like, am I depressed? Am I this? And I was like, no, it's fine. And so just little, things that are hard to pick up unless you happen to know somebody who went to the train, it's just you would never know. So that's what we're actually going to be piloting this year at Houston Methodist, is this universal intervention in the OB clinics, and just see how it works. I mean, I don't I actually don't anticipate it reducing scores on perinatal mental health measures. I actually think it may increase them because people are hopefully more comfortable saying if they kind of have an idea of, like, this is what a psychologist looks like. It's not like some weird old guy. Like, it's just
like, okay, you're in denial.
It's because of your mom. It's just regular stuff. So that's what I think. Just everybody kind of getting on board with the fact that this is hard. We don't provide enough supports for moms, and we need to give people the information and education to get ahead of this stuff. Matali Paul, she sent me right before this, and I had 5 minutes to skim it, and I was just absolutely delighted. She sent me, so there is a researcher named Harvey Karp, and he developed the Happiest Baby on the Block book. He wrote that book, and he invented the SNOO. Are y'all familiar with the SNOO? Oh my God, the SNOO. So Happiest Baby on the Block was this book talking about, it's the 5 S's, and so the ways to just kind of giving new parents ways to soothe your child. And you swaddle, and you shush, and you
cradle,
but it starts with an S. I can't remember, like swing. And there's a couple of other S's.
We need to break
that thought.
Okay. So, listeners, we are going to continue talking about prenatal mental health as soon as we return. You're listening to 99.5 FM. Welcome back to Chai Time here on 99.5 FM. For those of you that have just tuned in, we are in conversation with Dr. Jessica Rohr, and we are talking about maternal mental health. And before we went on break, you were talking about the resources.
So this researcher has put out some pretty helpful things for new parents. His team invented the SNOO, which is this very expensive but very effective bassinet that kind of shushes and swings the baby.
Oh yeah, I know that.
Yeah, the SNOO.
Okay, yeah. I was like, wait a minute, what is the SNOO?
It's great, very inaccessible for most people.
Yes.
And they just created a postpartum mental wellness toolkit. It is free to download. You can go to the Happiest Baby. I was just looking at it. I was just delighted by it because it really is everything that I like to do with my prenatal moms.
Yeah.
Just kind of giving a little bit of an overview. Here's what you might see. What is it about you that might make you particularly prone to these? So I had anxiety previously, like in grad school. So I was particularly prone to a postpartum episode. And talking through your village and talking through what do you hope that they do?
Yeah.
What are your expectations in your home for you and your partner? So it's just crazy. It's just so interesting to me how rare, being a psychologist, and my poor husband, who's an engineer, who has really had to, come up to my level in terms of how we talk about everything. But it's always so surprising to me how few people have just simple conversations about what are our expectations for who does the laundry in the house and how often and how do we like it to be done and where do we, and having a baby, I think, throws a lot of that into stark contrast. And so this toolkit really helps you jumpstart those conversations. It gives you language for how to set boundaries with family members who want to come right away. It's great. I just was delighted. And so I was glad Matali found that. Yeah,
I have my babies.
I know. I sent it out to my team right away. I was like, anybody please use this if you need it. So it's free. Look it up. I don't know if I could send y'all a link, and I don't know if you post it somewhere.
Yeah, you can send us a link. We can post it on our Facebook Live.
Okay.
Yeah.
There's plenty of other resources that I can go over at the end, but that's that one just was consistent with what we were talking about.
So. That is very interesting.
Yeah, it's cool.
Wish I had that too.
I know.
So sad. But so what bothers me the most is the underserved communities, the women that have had babies and that are going through this, but they don't have the resources for this. Mm-hmm. So I mean, I wish there was more that we could do to help them. Mm-hmm. Like, what are your thoughts on that?
So that is, that's absolutely a lot of what we are working on in our clinic, and from a research perspective. And luckily, I guess it's a strange word to use, but from a research perspective, that's where a lot of the funding is right now.
Good.
Is in how these communities that have been completely ignored, completely kind of left to whatever, and the damage that does for them and our society as a whole. I mean, it's really shameful. So there is a lot of research, and where there's money, studies will follow. So I feel
Good.
optimistic about that.
Yeah.
But another piece of that is impacting policy, and how can we help to impact policy that helps these women. So for instance, and I'll mess this up, and I'm sure somebody will correct me at some point in time, but when you're pregnant, you gain access to Medicaid, but it ends really quickly after baby's born. I think it's 3 or 4 months. And so there's a move right now to have that expanded to 12 months post, so that mom can still access needed resources up to a year postpartum. Because 3 months, 4 months, we see the biggest spikes, or big spikes in depression and postpartum PTSD at 6 months post. So that's not enough. That's not enough time. So really kind of policy is where a lot of, and that's a very new world for me personally, but I'm starting to get into that a little bit more. The Hackett Center just recently put together a maternal behavioral health roundtable to bring together folks from clinical worlds, research, policy. March of Dimes is involved in it. Mental Health America is involved. So just to try to start to solve this problem as a collective, as a collaborative, as opposed to everybody just kind of working here, I sit and do my research and then I go to bed, but bringing it all together and trying to treat it like a village. I mean, I was thinking this is a lot like being a mom, where I can try to do it in the way that, society says you should do it independently, and I do it myself, and I can, or you can do it with the help of all these people around you, where you're bouncing off ideas, and that's the only way I think we're going to solve the problem, because it's not just what's the brain mechanism that's messed up in people with postpartum. It's so much more complex than that, and it's an issue at all levels of society.
I feel like it's a ripple effect, right?
Absolutely.
So
absolutely.
How do you help someone that you know is experiencing or demonstrating signs of distress, yet is not open to seeking professional help?
It's a really tough question, and I think is a question a lot of people have, because most people are not open to seeking professional help. So I don't think it's a rare occurrence. And so I think this may be a really unsatisfying response, but I think we have to really challenge our own issues with people being mad at us and upset with us, because that stands in the way. I cannot tell you how many times I've had family members, friends of people who've come in and said, I wanted to say something, I just didn't want to upset them. I didn't want them to be mad at me, which I'm sure felt like a really big deal in the moment. Yeah. But after something big has happened, it doesn't seem so big. Yeah. But we're really uncomfortable with that as a society, making someone mad. I am too. I'm not saying I'm immune to it. It's just, it's amazing how much. So if you take that piece out of it and say, because I think the implied part of that question is without making them mad. But I think if we take that part out and just say, I might make them mad, they might be upset with me, but I need to tell them this is not okay, something's going on. So when I was sick, when I had postpartum with my first, my best friend called me and was like, what is going on? Something is going on. She lives in Dallas, so she said, I've heard from it. So my other friend called her and was like, Jessica's not okay. She's not okay. Yeah. And so I've thought, that is a piece of it, like accessing other resources in that person's community and saying, can we kind of talk together about how to do this? And she talked to me and said, what do you need to do? If one thing changed, that you think would make it better, what would that be? And so she was really willing, but I think we've been friends for decades. Like at this point, she was willing to do that. Not everybody has that, but a willingness to say, this isn't how it should be. Because that's, at least for me, what I kept thinking, oh, well, people said it was hard. I guess this is just what they meant by that. This isn't how it should be. I've read about postpartum depression. I think that might be. I want to call some folks to see if they can get you in. Not do you want me to call, not can I call.
That's amazing.
But I'm going to call and put the onus on them to tell you no. Because if I go back to what are women socialized to do, we are absolutely socialized that if somebody says, do you want me to blank? Oh, no.
Yeah.
No, of course not. I'll do it. Don't worry about it. Man, the conversations with my husband about that one. Do you want me to take the kids so you can have a few hours? And it's like, yes. But what I
That
say
was
is,
us yesterday, actually.
yeah. But what I say is, oh no, it's okay. I can. But if he said, hey, I'm going to take the kids to the park,
Yeah.
then I don't have. Oh,
Yeah.
okay. Well, that's so practicing saying I'm going to do this and letting the person disagree. Okay. Well, then if you don't want me to call somebody, I'm going to look them up and I'll sit with you while you call. So really intruding a little more than we're really comfortable with here in the U.S. I do think culturally there are some differences, and I would kind of look to you to help me understand those. But
So, but I think within our friend group, we are kind of like that.
a little more comfortable intruding.
We let each other know. So, But culturally, I do believe that there are things that you just don't step over. At times.
Yeah.
And mental health, unfortunately, is one of those things.
Yeah.
It's very
It's their family issue. Let's just keep your nose out of it.
absolutely keep
Which
it in the
I
family
believe-
is a big.
But I don't agree with that.
Exactly, but it's absolutely pervasive across every culture I encountered, honestly, at this point, and kind of tried to learn about. So, but I think that's the best to go ahead and do, because speaking from experience and speaking from, working with women, I become this kind of repository of all of their experiences, and so it's not research, but it is. I do kind of pull together these themes. Yeah. But that's one of them. It's just the thought of having to do something else. Even self-care is like another task they have to do.
Yes.
And it's like, God, man, I don't want to have to. So the thought of like, okay, so what? So your friend comes to you and says, I think you're depressed. Bye. So what?
Yeah.
Okay, now what? And so having that extra step and that extra, taking on that extra emotional labor of, I'm going to reach out to some people. I'm going to find some people for you is, I think, makes all the difference in that. Are you familiar with emotional labor? That's like one of my favorite go-to phrases. So emotional labor or mental load, those are the two ways that it's been described. It is something that, again, women are more likely to hold and carry. So when we talk about a task, making dinner, there's actually three components to that task. There's the preparation of the task, the the conceptualization of the task. We need to eat dinner. Yeah. The preparation for the task. Yeah. So what do we have in the pantry? What's in the fridge? Do I have time to go to the grocery store? Do I get it delivered? Ava's only eating berry yogurt this week. Chloe's only eating mac and cheese out of the cups, not the packets. Doing all of that. Yeah. And then the execution, which is the 30, 45 minutes it takes to actually make the dinner. Yeah. Women often hold these top two, the preparation and the conceptualization and the preparation. So that is what we refer to as emotional labor. All the stuff that has to happen up here before the task actually occurs. Buying the kids new clothes. Actually, this is the best way to describe it without going on and giving all these examples. I saw a TikTok, which I'm only on TikTok for research purposes.
Of course.
They did not teach me how to do my eyeshadow. Man, those kids though on TikTok, I love it.
Yes,
I think it can quickly become toxic, but I have also found it like I'm more comfortable in my skin. I'm pretty excited about the next generation. I'm excited about them. But I saw a great TikTok where she said, "Ladies, so at Christmas, people fill stockings at Christmas, who celebrate Christmas. Ladies, if you want to be happy on Christmas, fill your own stockings." And her male partner is standing by her, and he goes, hey, I told you I would do it if you tell me what you want and where to get it.
I might as well do it myself.
That's the first two. Picking it up is the easy part. Are you kidding me? I'm not going to do that. So that, I thought, was just a perfect example of what the mental load is. So, and when thinking about finding a therapist, just showing up at the therapy appointment is the execution. So when you tell people, you need to find a therapist, the idea of everything that has to happen up to that point feels really daunting because, one, therapy is not like a super common part of our culture, of our society. So it is a little bit, it's hard to even know where to look. And two, then you start calling, and we're in a mental health crisis in America. Everybody's got wait lists. Everybody's months out. And then you got to sign up, and then you got to find childcare, and then you got to try and get out of work a little early, and then you gotta if you have help at home, let them know it's a lot. It's an immense hassle. Yeah. So back to your original question, I think helping with that, a lot of the mental load of that will make it easier for someone to access help. And we don't actually, there's actually quite a few resources where you don't even have to get into therapy to potentially find some relief. Should I talk about them? Sure. Okay.
Hey,
postpartum.
Mike is yours.
So Postpartum Support International is a huge foundation in the U.S. Well, it says international, but they're primarily in the U.S., but they have a lot of different kind of cultural subgroups that they serve. Okay. So I know that they have they have support groups for Indian women. I know that they have support groups for Hispanic women. They have only Spanish-speaking support groups. They have them for men who are dealing with postpartum, people who are dealing with loss, it's just, they have an amazing array of people with infertility issues, people with like loss after, it's really amazing. And they're all virtual and they're all free. And so that is something that's available if people are comfortable with virtual, which I think it's sort of generational, but I think people are more comfortable because of COVID.
Yeah,
so,
agreed.
And then also there's a directory on PSI for local providers who do who are trained in perinatal mental health or do this kind of work. And then just some reading resources. Yeah. So there's a lot of ways to access information about it. But again, if you're a friend or a loved one or a family member, even the PSI, because there is so much information, even I look at it, I'm like, God, maybe there's so much stuff here. Yeah. So just a simple, just this one is the one I thought of for you. Look, it's Saturday at 11. Do you want me to come watch your kids while you go to it? Just helping with some of those parts.
Oh, I thought you were asking me.
Oh! yes, of course. That's great.
Yeah, day 9.
That's funny. So that's a great resource.
Nice. Okay, so actually talk about the lifespan approach.
Oh yeah, we were talking about that on the break. So another thing that we've been sort of banding about at Houston Methodist is the idea that the continued, I keep thumping this. Should I stop thumping it?
No,
is that
okay?
You can do it. That the continued focus on postpartum as this sort of just siloed little thing that happens and then goes away and that's it and that's all it was. You don't worry about it until you're pregnant and then once you're done being pregnant, it's gone. Yeah. Is so inconsistent with what we actually know about a woman, her hormonal shifts throughout her life. What women know about their hormonal shifts. Yeah. I gave a talk a couple of months ago and I put up a really simplified picture of how our hormones shift throughout our menstrual cycle. And I tell you, half the people in that crowd took a picture of it.
Wow.
Because we don't, anything we're taught about our menstrual cycle in childhood is usually primarily related to hygiene. How do you keep yourself clean?
Yeah.
And how do you hide it? Yeah. Which is really a bummer because then people grow up with absolutely no hormonal literacy, no idea of this is how I feel at different parts of my cycle. This is how I personally adapt to shifts in my hormones, let alone folks who have hormonal issues or issues related to kind of hormonal shifts like PCOS, endometriosis, all of these issues that, again, are often overlooked by the medical system. Yep. So by focusing on postpartum only without putting it in the context of a full lifespan, I think we miss a lot of information that could be really helpful for women, just in terms of understanding your body and knowing how it works, knowing the limitations, honestly, of the medical system, because the research just hasn't been done on women, and knowing how to advocate for themselves because of that. Yeah. Really, really small example, but my blood pressure runs really low. I tend to get those, like, when you stand up too fast, I get those all the time. And so when it was hitting 120 while I was pregnant, for me, that was solid 30 points higher than my norm. And so I was nervous. I was nervous about preeclampsia. And they're telling me, no, I mean, it's 120, that's normal. And I was like, but not for me. Yeah. But not for me. Yeah. And so because I had that knowledge and that sense of my body and that sense of what, because I have the privilege of like what I do and also being surrounded by people who do similar things, I knew to advocate for a little bit of extra care around that blood pressure. Knowing our bodies and how to talk about them and what they're doing and why we feel at one part of our cycle like we could run a marathon and do every bit of work on our schedule for 3 days, and then in another part of the cycle, like we just want to sleep all day, and understanding why, and that's normal, and and then when it's not normal, I think is so powerful, because that again helps predict not just that one chunk when the hormones whoosh out of you, but the whole process of getting pregnant, especially if people are using IVF, or any other kind of, not just IVF, any other kind of fertility treatments that impact your hormones, to start to notice when your cycles are changing or irregular, that may be something important. We start entering perimenopause when we're 45. Menopause, for a lot of folks, is like, that's for, that's in like 7 years for me. that's coming up. So that is, and a lot of people don't really know that when your period starts to become irregular, you're probably getting into perimenopause, and you can expect some changes. So that I'm really advocating more from kind of an education and empowerment perspective, just understanding your body. I wear this Oura ring, and I'm not a rep for them or anything. I've just been kind of blown away by this new knowledge I have about my body. It tracks your temperature, so it tracks your ovulation, so you know when you're
getting sick.
It's incredible. Yeah. It's a really, empowering is the only word I can use for it. It's just kind of neat being in touch with my body in that way, when for so long in my life, my body was not for that. It was for, to be attractive to other people, and to be, and all the gross stuff, you want to hide it, and like you needs to all of these things
but things change also as you get older, right? Like your mindset changes. Yeah, I can't say that. Your give a crap meter starts to change, which is really freeing. It's really, really great. It is just all the little stuff we cared about when we were younger does not matter anymore.
Absolutely. And I see that a lot in women who have had children and are no longer, do I want to talk about this? Who are just kind of sick of doing the things they used to have to do to feel supported by the people in their lives. And they're like, oh, I actually figured out what really matters to me, and that stuff wasn't it. And so that's really nice, and that's really empowering. What's hard is when you're still in a system that expects you to keep acting that way. So that's a lot of the work I do, is like, how do we navigate that? When the people around you are going, wait, I liked it before when you did everything for me. She's like,
these tools are given. We're going off topic, but I wish these tools are given to the younger generation.
Absolutely.
So like from the get go, they're like, you know what? No, I come first.
I think a lot of that, just from my TikTok watching, it feels like a lot of that is happening. And I think, I've learned a lot about sort of these generational differences in how people view themselves and work and health and what's most important. And I think millennials have been teaching their kids to do it differently. But I also, we've talked about universal intervention. My boss, Dr. Alok Madan, I think he's been on here before. It's been like over a year. No? Yes? No? Okay. But he was just kind of thinking, universal intervention, why aren't we doing this in the schools? Why aren't we doing and people talk about that all the time. Like, I don't know how to take care of myself in a crisis, but I know the Pythagorean theorem, which I think is very important for some people. I don't want to, I'm sure the Pythagorean theorem is very dear to people. But this idea of, can we start from an early education model, at whatever point in time, when kids are still learning and searching for their identities and still really flexible and malleable, to teach them about themselves, about their bodies, about their place in the world, and their choices in that. And it's funny because I'm doing that with my kids, obviously, and they are just two of the, well, at least Ava is just, and Chloe is too, but she's a little more savvy about it. Ava
is she your younger one?
Yeah. Is that how it works? They just watch and they're like, I see what I'm supposed to do. But Ava is outspoken and just very my body, my choice. And she's starting kinder in the fall. And I actually had a pang of like, how is this going to go? Because teachers that have been teaching for 20 years, I wonder if they're seeing a shift in how kids relate to each other, how they relate to the teachers, how they think about them. These ideas of, I need to be good for the sake of being good. I don't know that they're quite so. I need to be good so the teacher likes me. I need to be good so I get the best grades. I think now we're teaching them, we're kind to others because
Yes.
that's what humans do,
Yeah.
and we're kind to ourselves, and we can say no. You don't have to say yes
Exactly.
to everything an adult
Yeah.
says. And I had this little thought of like, how is that going to go for her? But we'll have to see.
I tell my
Hope it'll
kids
go
they're
fine.
the boss of themselves.
Yeah.
And no one can tell them what they can and cannot do,
Yeah.
except for your mommy.
Yeah.
Your mommy can tell you what
That's
you can
always
and
the
cannot do.
exception.
Other than
Absolutely.
that, and your daddy, but other than that, no.
And it's such a great thing, and I do have to think that the societal norms will shift in response to that.
Yeah.
With enough kids having that
Yeah.
what's the word, that idea.
Yes. Yes.
So yeah, I love that, and
Yeah.
I am excited about that generation. They're kind to each
Yeah.
other. The way we talk about bodies is so different from how it was in the 90s.
Yeah.
If I have to hear one more time about so-and-so bounced back after having her baby, it just makes me want to throttle. Bounce back. Bounce back.
That's an eye
She
roll.
grew a person.
Yeah. Yeah.
With her body.
Exactly.
Like, it's nonsensical.
No.
But, and luckily, I think people agree.
Yeah.
So it's
Yeah.
really nice.
Absolutely. So we're almost out of time, but I want to ask you one last thing. I want you to give advice to the listeners, our women listeners, about just what if they're going through prenatal God, keep saying menopause,
Mental health.
mental health,
Maternal mental health.
maternal mental health. What would be the one advice that you would like to give them?
Talk about it. Don't keep it inside. I cannot even count the number of times that somebody has spoken about something either in one of my groups or to me or in a friend, like even outside, like in a friend group, and had somebody else say, yeah, the same thing happened to me. And the first person said, I thought I was the only one. It is incredible to me. And I do think, again, that's shifting. I think there's more people talking about it in the media, more people being willing to share that it's hard. But when you are brought up believing that pregnancy is a miracle and that you're supposed to be excited for every part of it, especially for the vast number of people who have fertility challenges. I worked this hard for this baby and now I'm having a hard time with it. Yeah. There's so much shame around it, and that shame can only be dissipated by speaking about it, which is the absolute hardest thing to do. And I'm saying this with full awareness of that. Yeah. But once you do and you realize that you're not alone, that doesn't mean it's normal. Yeah. But in fact, it can be validating to hear, that happened to me too, and it helps a lot to get some medicine, or it helps a lot to talk to somebody, because that's probably not just going to go away. If you can't talk about it to someone you know, then look at one of these resources, look at PSI, go online. That's another, I stay in some Facebook groups for moms, and that one is more for research, because I just like to see, like, how are people talking to each other, what are people bringing up? But you can find people who are having similar, even like Babysitter, I think is one of those kind of blog sites. But don't just let it sit in there, because it's not going to go away. And talking about it will help. Even just having support, validation, and permission from other people for what you're experiencing is profoundly meaningful. Yeah. Yeah.
So talk about it, ladies. It's important.
Yeah.
It's for yourself, for your health, for the health of you and your family and your kids. Talk about it. Yep. It's okay. Yep. So thank you, lady. Thank you. I was gonna say ladies because I had it's all young. But thank you for joining us and helping spread awareness. It is always such a pleasure having you on the show, and this is our second time with you, and now we have you in person, so it was amazing. So thank you, and hopefully we can have you come back and talk more about this.
I would love to.
Because it is, we want to spread awareness, and we continue to strive to do better. So thank you, everyone, for joining us here on 99.5 FM with your Chai Time Girls. Until next week, thank you. Bye-bye.